Dr.
convention
Cassano,
so far.
tell us about how you got involved in the convention and the platform committee.
I liked Bernie Sanders. Several years ago, I had actually testified to him at the Veterans Affairs on the Veterans Affairs Committee, and so I knew of his work with veterans. And when he started to run for president, I liked what I was hearing. I'm a very progressive Democrat, and I liked his issues, and I wanted to support him. So I supported him, not just financially, but when the campaign came to Connecticut, I actually housed all of the staffers at my home in Hartford, and got to know them very well. I had put my name in for the first time to be a delegate to the convention. Right after that election, I got a phone call and they said, "Would you mind being on the standing committee?" And I said, "Sure." And so they said, "Well, put your name in." I said, "Do you want to know anything about me?" And they said, "No, not really. We just need a female to be on one of the standing committees." And 10 minutes later, I get another phone call. "Are you up to being on the platform committee?"
What specific things were you able to help with to get into the platform?
I was looking for specifically for issues that I could address, such as the Trans-Pacific Partnership, the fracking, worker protections, worker health, environmental issues such as lead and water safety, air quality. And so as I read through the platform, I wanted to help with some of those issues, but then there were a couple of things I felt were missing, specifically on the public health side of the House. And so I proposed two amendments. One was on agricultural worker protections, to make sure that they had regulated, that we were now going to move toward better regulation and better occupational safety and health regulations for agriculture workers, to include work hour standards, water and sanitary conditions in the field, and reduction, basically elimination of child labor, and better housing for the migrant workers when they're farming our food. And actually, that amendment got accepted as part of the consensus document, so it never came up on the floor of the platform committee. The other one, which I felt was equally important, but probably more dear to my heart, is a amendment on public health education and ensuring that public health education was funded at the appropriate levels that it needed to be, including undergraduate, graduate, and medical education, postgraduate medical education. And that was presented on the floor and also got adopted. So I was 2 for 2 and very happy. It was a wonderful experience, just working with people from both campaigns to move policy forward.
And what would you tell your fellow physicians who are trying to decide how to vote in November?
Well, I don't mean to be rude, but I don't think Donald Trump has any cogent idea about healthcare other than, we're going to take it away from everybody. After 20 million people, he's going to kick off of these. He's going to do away with the ACA, kick 20 million people off of health insurance, and he's probably, and beyond that, he doesn't know what he's going to do, which means that it'll be a free-for-all.